IV sedation, the way we teach it, is very safe because we teach titration, careful titration of the medicine, so you don't overdose the patient and get them into the next phase or get them into trouble. We also spend a lot of time making sure that you know exactly what to do in all the situations that can occur with IV sedation. So if the patient stops breathing or they're partially obstructed, you will know when you leave our course exactly what to do. And we also recommend that you bring your staff along with you because it's critically important that they know what needs to be done, not only to set up for IV sedation in your office, but also to be there for you and know what to do in case there is an issue as far as the airway or any other medical complication that can come up. We also teach you which patients are not appropriate to do IV sedation. You're not going to sedate every single patient. If you have someone who has all kinds of medical problems or really bad airway, so just because the patient wants sedation, that doesn't mean you have to do it. You are the doctor. Everything's under your control. You decide which patients are appropriate to sedate and how to sedate them, how lightly, how deeply to sedate them. So it makes it very safe. And the way we have it set up is you're not going to a hospital and going to an operating room, going to an oral surgery clinic where you just start the IV and push a couple drugs and stand there. You're actually working one-on-one with a mentor who is an IV sedation trained, moderate sedation trained general dentist that knows exactly what you do in your practice and will be able to help you become comfortable at doing what they do and bring all this back to your practice. And as I mentioned earlier, one of the key essentials to this is having your staff with you so that when you go back to your office, you can implement everything that you learned. And we also help you get all the materials, all the supplies, all the monitors you need so that when you bring this back to your office and you want to start doing IV sedation, there's really nothing that you have to think of. We make it very easy for you to be successful because a lot of people who take an IV sedation course, and I think something like 85% of people who take IV sedation never implement it in their practice. And our goal is to have 100% of our students do IV sedation and reap the benefits of what that brings to their practice and to their patients.